This is the video on urinary tract symptoms. We can start with pathology. So let's start there, and then we can go down to like the specifics of urine itself. So let's talk about the common thing that we see in pans and pandas, which is the frequency, urgency, and involuntary urination. So with involuntary urination, we want to know what time it happens, if at all possible. Is it, so if it's overnight, checking in on your kids, is it the first part of the night? Is it the second part of the night? Is it only happening at night, or is it also happening during the day? Is it only happening during the day, but not happening at night? Is it only happening with laughter or with anxiety? Is there something that precedes it that leads to the involuntary urination? Is it an entire bladder? Is it just a tiny little bit, like a little dribble? Does it come with menses? Do you have involuntary urination only with menses? That kind of thing. There's an enormous amount of things that you could say related to like when the urination happens. So just look for anything. It could be beyond what we've talked about here. Dr. Petersons, why don't you talk a little bit about frequency versus urgency?
Yeah, so our kiddos will have both of these symptoms. Some just have one or just have the other. So urgency is the need to go like right now. And then is it that they actually have to go, or is it just the sensation, the urging of the urination, not actually needing to go? Or frequency, you know, how often are they going? Are they going a couple times an hour? And is it happening, you know, in relation to other symptoms again? Is it happening during anxiety or before leaving the house? That type of thing, how much urine, and then of course the volume of urine. Is it a lot of urine, a little bit of urine? What does the urine look like? Is another important symptom. And its odor, you know, does it have a greenish tint? Does it have blood in the urine? Is it sandy? Is there a bunch of white sediment in it? Is it really foul? All of those things. Is it oily, shimmery? Can be useful. As well as sensations, right? Does it burn? Does it sting? Does it happen before urination? Does it happen during urination? Does it happen after urination? Does it happen only when standing, when lying down, only right before bed? All of those things really useful when it comes to urinary symptoms and very characteristic.
And one thing that can be helpful to tease out, but may not also always be possible, is that sometimes kids will have urgency or frequency that's really more OCD, not an actual sensation, like a fear of needing to go to the bathroom and not being able to find a place. And so if you are able to tease out any sensations that they might be experiencing, or get them to talk to us, we are sometimes better at teasing out sensations and doing it in a way that is more reliable, because when we ask questions about things, they're more open-ended and not, does it feel like this, which is how parents tend to ask questions. So if you can at all get people on, get your kiddos on the call with us, that would be really optimal. But obviously we know that's not always possible. So it can be helpful to try and tease out, what does it actually feel like in an open-ended question, not does it feel like this or this or this? Because then kids will oftentimes feel like they have to choose, and they say, you know, yeah, it feels like one of those things. So asking them what it feels like. And then if they don't actually have the sensation that they need to go, then we could tease out a little bit more like, what's making you want to go then if you don't feel like you need to go, and then we can get a little bit more details about that too.